There is a growing backlash this morning over the president's seemingly cavalier removal of his mask when he got back to the White House from his hospital stay last night. Health officials are warning not only about the message it sent, but also that he runs the risk of infecting the White House staff with coronavirus. Dr. Anand Parekh is the chief medical advisor at the Bipartisan Policy Center and also a former deputy assistant secretary in the Department of Health and Human Services. Dr. Parekh, good to see you again. Just first off, your response to what you saw when the president took off his mask at the White House. Are we maybe reading too much into that?
Alexis, I think it's very, very important that, particularly over the next couple of days, while the president is infectious, particularly, that he adheres to public health guidance. And that means everything from wearing masks to staying physically distant to having good respiratory etiquette, hand hygiene. There are hundreds of employees who work on White House grounds, and anyone exposed will need to be quarantined. So, in general, it's important that the president follow these public health guidelines, but it's really, really important right now because he is still likely, Alexis, probably in day 6 of his course right now, still infectious. I think he's still not out of the woods yet. For him, I think we worry, particularly at his age and given his risk factors, sort of day 7 to day 10, when the immune phase of the virus kicks in. Now he's on a steroid. Hopefully that'll blunt it, but he's not out of the woods, and certainly everyone around him has to be careful. He's going to need to be isolated and follow public health protocols.
Doctor, let me read this tweet from the president we got about 2 hours ago. Flu season is coming up. Many people every year, sometimes over 100,000, and despite the vaccine, die from the flu. Are we going to close down our country? No, we have learned to live with it, just like we are learning to live with COVID in most populations, far less lethal. Your response to that?
Yeah, it's apples and oranges. Totally different situation here in terms of what we know about flu, what we know about COVID-19. Mortality rate for COVID-19 significantly higher than flu. For flu, of course, we have a vaccine. We have a variety of treatments for COVID-19. We still await a vaccine. We still await more treatments. So it is very much an apples and orange comparison. It is an important point that all Americans should be getting a flu shot. We need to take flu off the table, particularly this fall and winter, so the healthcare system is not trying to deal with both COVID as well as flu. So that is an important point. But he still, Brian, doesn't get it. And I think that is the concern. I think we were all hoping that he would pull through, and he is, and it's great to see that he's seemingly feeling better. But I think we were also hoping that he would be much more humbled and sobered after his experience in the hospital. After 210,000 Americans have died, that he would send in the important message that this is not something to be cavalier about. We need to take this seriously. We need to wear masks in public. We need to be physically distanced. We need to do all the things that he hasn't been doing. And so I think it is concerning to read some of the tweets that are coming out.
Doctor, let's stay on this one. The president also said in a video he might be, quote, he may be immune to COVID-19. Have you seen that with any patients anywhere? And is that possible?
He shouldn't be making any scientific statements. I think, the experts have been clear throughout this public health crisis. Sometimes he uses language. He's not quite sure what he is saying. But no, right now he is infectious. He's in day 6 of his bout with COVID-19. These are critical days for him. The rest of the week, he is ill. He is infectious. It's going to be really important to measure and note his oxygenation status. I think for his health, for the health of people around him, he needs to be focusing on recuperating and making sure that this outbreak, which was preventable, doesn't continue to spread across the White House.
And doctor, before we let you go, there's this report today the White House is trying to block new FDA rules over a coronavirus vaccine. What's behind that? Is this because they want to try to rush this vaccine to market ahead of the election, maybe?
These are really non-controversial standards that the FDA has put out there as guidance to manufacturers. They want to make sure that the tens of thousands of Americans who are participating in clinical trials right now are followed for an adequate amount of time. They're saying a median of 2 months to ensure there aren't adverse events and to ensure that the effectiveness of the vaccine is longer than just short term. So they put out this information. I think manufacturers get it. There's going to be an FDA advisory committee that's going to discuss this on October 22nd. This is really not something the White House should be getting involved with. It really seems like sort of the politicization of science. So the White House should just let the FDA do its job. The FDA knows how to do this. The FDA works with manufacturers every day. They work with independent advisory committees. And so hopefully we need to let that process stay out, because, Alexis, at the end of the day, it's not just about vaccine approval. It's also about vaccine confidence and uptake. And we've seen some of the polls of the American public. Less and less people are saying that, or are committing to definitely or probably getting a vaccine. So we need to build vaccine confidence in this country. And the way to do that is to let the FDA do its job.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.